Hey guys, Dr. Josh here at Steinke Family Chiropractic. Today we're going to show you an example of what an adjustment looks like here in our office. If you've been to our office before, you know that our technique and our style of adjusting is quite a bit different than what most people are used to when it comes to chiropractic. A lot of people who've never been to a chiropractor have an idea of what to maybe expect. If you've watched videos before, I've talked to friends who've been to a chiropractor, but what you're going to see is what we do is quite a bit different than even what people have heard or what they've experienced in the past. So I just want to give you an example of that. And today, I'll kind of walk you through step by step what to expect if you come in for an adjustment or if we're adjusting you in our Chiro to Go trailer. So today I have with me a beautiful 13-week along pregnant mama. And so we adjust a lot of pregnant moms here in our office from early on in the pregnancy and then all the way through the pregnancy until post-delivery and so on. So I get not everybody's going to be pregnant when they get adjusted here, but I just wanted to show you a couple of things. Typically when a mom gets to about 20 weeks, depending on the mom, but around 20 weeks, we use what's called pregnancy pillows to adjust. So you'll see she's going to lay face down on the table for us here, and that's what most of our people do. We're going to lay on our tummies. But obviously when a pregnant mom starts to become farther along, it's hard to lay on her stomach. So we have these pregnancy pillows with the center cut out that allows mom to lay nice and flat and stay comfortable. Today we won't need that for her. So when you get adjusted here, we lay face down up on the table. This is face paper for you. Feet are gonna be barely off the end of the table. So you'll see our tables maybe look a little different than other chiropractors you've been to. They're a little higher. There's not a lot of moving parts. They're pretty straightforward. The nice thing about during this adjustment for our patients is they get to lay nice and flat and relaxed. They don't have to do a whole lot of moving around. I pretty much do all the work. You'll see I get a lot of steps in a short period of time here as we're doing our checks. This technique is called torque release technique. Torque release technique uses an analysis that allows us to do checks and balances to be able to find what's called subluxation in the nerve system. Subluxation is what chiropractors adjust. That's what we are specifically trained to do to locate, correct, and maintain the correction of vertebral subluxation. So that's what we're looking for. A lot of people call that being out of whack or pinched nerve or a lot of different kind of misnomers that we have with it. But for this video's purposes, what we're looking for are the areas where we're finding a problem, that vertebral subluxation. When we find those areas, we'll adjust, and with torque release technique, we adjust using an instrument called the integrator. So a clicker tool is what a lot of people call it because of the noise that people hear, just that little click. Very pretty gentle, very precise, very specific. One of the reasons we love this technique is because of its precision, because of its gentleness in the grand scheme, and because of its effectiveness. Like, we love doing this technique, and we do this technique here in our office because it gets results, and that's what people come for. Removing subluxation is what the result that we are looking for as chiropractors, but obviously as the patient or the practice member, the client coming in is looking for results as far as feeling better, moving better, seeing their bodies healthier, and maintaining that health as time goes on. So I'm gonna get into this technique and you can kind of just watch what we do. So most of the time when we're adjusting, I'm down here at the patient's feet and we're doing some different neurological checks and reflexes. This is what a lot of people think I'm playing with their feet, but in reality, what we're doing is a functional reflex of the Achilles tendon to be able to see how the body's balanced. And then we're gonna go back and forth, checking some different areas to see where we find some balance and find some areas that we're having those vertebral subluxations. I'm gonna have you turn your head to the left, please. Good, and to the right. Good, back to the center. So we'll go through a series of these adjustments, checking and rechecking as we adjust, doing some different specific areas of checking if there's any particular issues going on with somebody that day. In today's particular case, she's been having hip problems and pain in her hips. Obviously, when we have a pregnant mom, as time goes on throughout the pregnancy, some different things that are going to be a problem. So head left for me. And to the right for me, back to the center. So once we're done adjusting, we'll have them relax for just a second here, but then we'll have the patient come on up. And that's literally the adjustment. It's pretty simple, it's very efficient, it doesn't take a whole lot of time, but our patients definitely notice a big result, sometimes immediately and sometimes a few days later. And especially if there's some big issues going on, it might take a series of adjustments to be able to get the results that we want. Time and repetition are important to health, right? We tell our patients, we explain to them that health isn't a thing that happens overnight. It's an ongoing process, not an event. So just like anything else when it comes to health and wellness, we have to continue that habit of staying in good alignment, staying subluxation free, and maintaining those adjustments. So hope this helps you. Hope this gives you an idea of what to expect here at the office. God bless you and have a great week.